So it's been a little while. I've been off doing lots of fun things, but I wanted to make a video on my pre-op appointment that I had and some things that I got there, and then some other items that I have purchased on my own to prepare for life after this surgery. So this is a surgery haul video. Just as a reminder, I'm having an abdominal radical hysterectomy, and the cut will be horizontal across my bikini line. I don't really know how big the cut will be. I don't know if it's dependent on the person. I've heard of some women that it's from hip bone to hip bone, which kind of freaks me out. And then I've heard other women it being much smaller, like 4 to 6 inches. So I have no idea. When I wake up, I'll see. I'll find out. But I had my pre-op appointment, and what they did there was essentially go through my medical history and drew labs. They talked to you a lot about the surgery and what to expect afterwards, and they send you home with a basket of stuff to take with you and instructions to start leading up to your surgery day. So one of the things that I got that I think is going to be really important is this. Get you close to it here. It's called Impact Advanced Recovery, and I hear it does not taste good, but they give this to surgery patients to take 3 times a day, 5 days before surgery. So I've got a whole carton of it that I'll start drinking. And essentially it's like a lot of protein, vitamins, carbohydrates to help prep your body for an intense surgery and traumatic experience. And the hospital that I'm going to has implemented this as standard practice for the past 2 years. And since that time, their infection rates and hospital stay times have shortened dramatically, and it's practice now for patients to start taking this. My mom, actually, for those of you that know me personally, know that my mom has been dealing with her own health issue this year. She was actually diagnosed with cancer in January and had major surgery to remove the cancerous tumor. I believe it was in February, and had radiation after that. And she had to take this too. She took it. I can't remember if she took it leading up to the surgery, but I know that she had it in the hospital as well, and she hated it. So I'm planning on chugging it and getting it down, and maybe putting it in a smoothie or something and making it work. So I got that there. I have a whole carton of it. I also got this stuff. Hibiclens, I think is what it's called. I don't know if this is standard practice for patients to use this leading up to a surgery, or if it's just from me, because I have had community-acquired MRSA before. And if you've had that, then you know that it lives in your body, from there on out. I haven't had any active infections recently. I've only had one. That was the time that I got it. But this may be standard practice for all I know. I don't have surgery that often. But basically, I have 2 bottles of that, and I have to rinse, wash with my body with it the night before surgery and then the morning of surgery. And essentially the point of it is to get rid of any bacteria on your body. They want you to come in as clean as possible to the operating room. Reduces the chance of infection, essentially. So something else that they gave me is this bad boy. I think that anybody who's had a surgery probably knows what this is. It's a spirometer, and it helps with getting your lungs healthy after surgery. Anesthesia can hurt your lungs and can actually cause pneumonia, and they have you do this leading up to the surgery. So I have to start doing breathing exercises with this about 3 days leading up to surgery, and then once I have surgery, I'll have to do this at least 10 times a day. And I have a certain goal that I have to reach. And it's actually much harder than I anticipated. I feel like, I'm a healthy active individual. I have decent lung power, especially since I do yoga quite a bit, and breathing is a big part of that. But it's harder than I thought to do what they want you to do. It's a lot of breath control, and you can tell it's really working your diaphragm when you use it. So my mom's going to help me keep on a schedule with this and use it, because I definitely don't want pneumonia and want to recover as quickly as possible. So those are the things that I got at the hospital. I don't know if other patients who may have like comorbid issues or something may have other things that they got. For me, I don't have any other issues. My appointment was relatively quick because I didn't have to do any additional testing outside of just having my blood drawn. So it was pretty quick and painless, and it was odd. It was weird walking into the hospital. It definitely made me feel like, okay, this is happening. It's definitely gonna happen.